Hi. So what we're going to talk about now is the same kind of idea. We're going to talk about how anxiety works psychologically, especially in terms of the CBT idea that our thoughts and our behaviors influence how we feel. And then we're going to try and understand that a little bit better, about why we feel anxious and why we sometimes feel over-anxious. And then we're going to look at one or two things we can do to actually feel less anxious. So anxiety, if you're trying to understand what anxiety have it and why does the human body have it at all, it's like a car alarm. Every car has an alarm now, but anxiety is a car alarm that can't tell the difference between a football hitting it and a gust of wind. It can't tell the difference between a thief and something that's inconsequential. And so anxiety is going to go off. The alarm is going to go off if someone bangs into it or if someone breaks into it. And our body does the same thing. Our anxiety will go off whether it's something really threatening that we should become frightened of or whether it's something that's inconsequential. And our body can't tell the difference. So when we're thinking about anxiety, we're going to think about biological, so what happens in our body, psychological, what happens in our mind, and then the social circumstances in which these things go on. The biological, everyone knows. It's heartbeat, it's stomach, it's sweating, it's all the things that I'm showing you right now live on Facebook that they're seeing in close HD. It's all the psychological, it's all the worries that are going on. Am I saying the right things? Am I doing the right things? And it's the social environment that I'm in. This would be fine if you weren't here, but you are the stressor that I'm feeling at the moment. And that's all going on. It's the interaction between those things. And so when we're trying to think about what we're going to do if we're going to treat anxiety, if we're going to improve the level of anxiety we'd feel, so we're going to have a look across all three things. And as earlier speaker said, there's no one plan, perfect plan for everyone. And so everyone is going to pick a few pieces from different areas. So for some people, medication may be helpful. For some people, diet may be helpful. For some people, exercise may be helpful. For some people, the biological processes like sleep and rest and relaxation may be very important. For most of us, psychologically, a little bit of personal reflection is going to be really important about what are the things that stress me and why. Why is this triggering for me? Something like meditation may be very helpful. There's a lot of very good evidence now that actually if we can slow ourselves down for a few minutes every day, that we slow our body down, we feel less anxious. And then for some people, if it becomes overwhelming, that's something like therapy or CBT that I spend my life doing, that might be helpful. But then there's also, no man is an island. We don't exist on our own. We exist in a context. And that context is the social pressure we might be under with friends or family or work or the economic environment that we're in. And we will be looking at reducing some of the social pressure and increasing some of the social support. So when we're thinking about what happens in anxiety, we're going to think of the physical piece. We're going to think about a thing called safety behaviours, which is what we do to try and keep ourselves safe, but often make us feel more anxious. We're going to think about worry, the thing that goes on in our mind, and then what do we avoid? So often when we become anxious, we start avoiding the thing that makes us anxious. But actually, while that's really helpful in the short term, it's really harmful in the long term. And if we were actually looking at how we're going to recover from anxiety and from severe anxiety, we'd be looking to experience and tolerate the physical feelings of anxiety, to sit with them and not run away from them. To try and drop any safety behaviours we might have and test out any threats that we might feel. Try and reduce the worry that we might have in our minds and reduce the avoidance and build up some quality of life enhancing behaviours. And all of that is to feed into the middle piece. And that's to have positive but realistic beliefs about the world and our own ability to cope with the world. So the very basic fundamental thing about anxiety is, okay, I'm going to ask someone in the audience how old they are. Will anyone shout out their age? 60? Great. 16. It didn't sound like a 60. We'll take a 16. Okay. Anyone else? 24. Yeah? Yeah, you're all wrong. Go on. 61. Wrong. No. You are all those ages plus 70,000 years. Because that is the length of time the human being has been evolving. The body you are in is 70,000 years old plus your own age. And so your body isn't built for the modern world. Your body isn't built for cars and offices and computer screens and laptops. Your body is built to be a caveman or a cavewoman. Your body is built for running and fighting and fleeing and defending. Your body has survived 70,000 years. You are a miracle of evolution because your body is exceptionally good at doing this. And one of the things that has allowed us to stay alive, all of that, to live longer than dinosaurs, to beat the woolly mammoths, to outlive all of the other things that might have killed us along the way, is anxiety. In this respect, anxiety is our friend. It's very, very helpful. If your house is broken into tonight, anxiety will kick in and you will move at 100 miles an hour. If you smell smoke, you will have the kids out of the bed, you will be breaking down doors, you will be stronger than you thought you could be, you'll be quicker than you thought you could be. It will save your life. Anxiety stops us falling off cliffs, stops us wandering under buses, stops us putting ourselves in dangerous situations where we might die. And that's why, in terms of evolution, we have it. That's why it's in our body and why it's so useful. This is what our body will do. Our heart rate will shoot up, our blood pressure will shoot up, our heart will start beating, our lungs will start breathing, and it will push the blood to our hands and our feet, to our periphery. And we'll move it away from the center. And the idea is that, Kenny Egan is in the audience, we can either fight or run. We have fight or flight. And our body is brilliant at doing this, and this is why you are alive and you are in this room and you haven't been eaten by a tiger, because you have this. But one of the things is we don't live in the jungle. We don't live in a situation where we feel in danger all the time. We do work in offices, we do work in schools, we do drive the car. And that is not a useful response to those stresses. Our body kicking into gear, huge and overwhelming and ready to fight or sprint, isn't that helpful when our boss sends us an email or the bank sends us a bill, or one of our kids is stressed, or something is going on. So the stresses we feel in the modern world, our body is totally unsuited to dealing with. And so we do make lots of things to make that go away. We feel awful, and we want to push it away. And we might drink, or we might take drugs, or we might do something else to avoid it. Not go in the situation. So if going to the shops in a busy place, and a really busy supermarket feels really anxious, we don't go there. Or going to a place where we feel judged, where people are going to be very negative to us. There's going to be a lot of social judgment. Okay, well, I won't go there anymore. And that's fine. We will feel better for a short period of time. The anxiety will come down. But over the longer period, if we stop going to the shops, what happens to our life? Or if we stop going to the place where we feel judged, what happens to that place? Suddenly we have all these pieces of the map we can't go to. And that anxiety doesn't go away. Every time we have to approach it, we're going to feel more and more anxious. And so one of the things we have to do is learn in the modern world how to deal with fight and flight in an acceptable way, in a useful way. And so one of the things about fight and flight, it's built to sprint. It's not built to give you unlimited energy. It's built to give you some energy for a short period of time. And that length of time is about 45 minutes, 45 to 60 minutes. And actually, if we can stay in an anxious situation and tolerate it and talk ourselves through it and talk ourselves down through it, that anxiety will peak and trough over about 60 minutes. What happened? So has anyone ever jumped out of a plane? Yeah? Do you want to say what it was like? Was it terrifying? Yeah. Because humans aren't meant to be in planes, let alone jump out of them. And I imagine the person, you experience something like this. Your heart rate went through the roof, and then you land a couple of minutes later, and slowly your heart rate comes down and it becomes normal. What happened if you did it again the next day? Yeah, and the day after? And the day after. And if you kept doing it every day for 3 weeks, that's what it would look like. It'll come down and down and down and down. Now, it might never be perfect, but even jumping out of a plane wouldn't be as terrible as it was day one. And this is how we learn, how our body learns that things are safe. And this is, everyone in the entire audience has been through this, and they've been through it 100 times. When your mum brought you up to school on the first day of primary school and brought you there and sent you in, your anxiety was through the roof. And maybe she had to push you in the door. Maybe she had to leave you. Maybe there was loads of tears, so whatever. But then she brought you the next day, and she brought you the next day, and she brought you the next day, and then school was fine. And this is the same when you went on the first date. This is the same when you first learned to drive a car and crashed it around a car park. This is the same the first time you were in work. This is the same the first time anything happened. You felt anxious, and then as you did it again and again and again, you felt less anxious. So by going towards the thing we fear, the very famous book is called Feel the Fear and Do It Anyway. By going towards the thing we fear, our body acclimatizes. But the opposite is also true. By going away from the thing we fear, by avoiding or setting up barriers, our body never acclimatizes. It stays high. So if our body goes up and we bail, it never learns that it's okay. So if you had gone up in the plane and you're up there and you go, I'm not jumping. That would be a perfectly sensible thing to do. That would be okay. But your body would never learn that it was okay. You would always be frightened of jumping. And that doesn't really matter if it's, skydiving. It's not a big deal. But if that's going to work, or for some people going to school, or for some people getting in a car, then it has a very serious consequence because we never feel able to go and do that thing. And what CBT tries to do for people is help them do the behavior, actually go towards the thing. And we do it very gently, and we do it very compassionately, but there's only one direction, and the direction is towards it. And do the C, to do the thoughts that come with it. So how do we think about it as we're going towards the door of the plane? How do we think about it as we're going down? And then when we get to the bottom, how do we think about it again so we're able to go the next time? And that's what we try and do in therapy, is to help people go towards the thing that they fear and help people then to understand it in a way that allows them to do it in the future. So what we try and do is these two things. Are our beliefs about the thing that makes us frightened true? So are we going to die if we jump off out of the plane? Are we going to be judged if we go to the place where the people are awful? Are we going to be able to go to school, go to work, go to the supermarket? And what's going to happen to us if we do? And then can we teach our bodies to slowly and gently come down so that they feel relaxed even in difficult situations? And that might seem impossible, or it might seem really strange, or it might seem really odd, except you've all done it 1,000 times in your lives through difficult circumstances. And when you think then about people who are Gardaí, or who are nurses working in A&E, or who are firefighters, or are pilots, ordinary people doing ordinary jobs, but doing exceptionally frightening jobs, exceptionally difficult jobs, this is exactly how they learned to do them. They went in as a rookie, terrified. They were brought through again and again and again and again until they felt able to do those things. We send soldiers into combat. They learn how to do this through slow repetition of the processes, and they go towards the bullets. Firefighters go towards the flames. And us in our normal lives, we really don't have to do things as terrifying as that. We don't have to go towards the bullets. We don't have to jump out of the planes, but we can teach our bodies how to be okay with those things. So what are the sort of thoughts that people have about anxiety? And that these are the most typical sort of ones. Often, if I got more anxious, I'd faint, or I'd go mad, or I'd have a heart attack, or I wouldn't be able to cope. We might have thoughts about danger, something will hurt me, or vulnerability. In certain situations, I'm weak and powerless. Or embarrassment. If I do something, it'll be humiliating, and I'll be rejected. And I'm doing public speaking in front of loads of people, and this is the one that's flagging up for me at the moment. Lack of control, I will collapse or faint or cry. Or anxiety about our own anxiety. If I get too anxious, I will be overwhelmed. I won't be able to manage my own anxiety. And that these thoughts are in the back of our mind. They might be in the front of our mind. And it's only we can talk about it, and we can think about it, and people can reassure us. And I'm sure in lots of situations other people go, I'll be fine, it's no problem, you'll be okay. But actually, until we make that step and are able to tell ourselves it was okay. I went there, it wasn't perfect, I mightn't have enjoyed it, but it was okay. The terrible thing didn't happen. I went there and I went again, and it still wasn't amazing. I still really didn't enjoy it, but it was okay. The terrible thing didn't happen. And I went again, and the terrible thing didn't happen. And I went again, and I went again, and I went again, until it's okay. Until I can actually do this thing with confidence. And I was talking earlier before the break about self-esteem, and how do we build confidence and self-esteem? We build confidence and self-esteem by making that walk from doing things that we're not able to do to doing things that we suddenly are. And we become very strong and very resilient because we know, I did that. I made that walk. And for all the 4-year-olds in September who started primary school, that walk is in the front gate of the school. And for the person who's 16, that walk is going to be the leaving cert. And the year after that, it'll be college, or it'll be work, or it'll be a first date, or whatever it's going to be. It might be getting on a plane. It'll be very ordinary things, but that could be a very long walk. And we do it very gently and very compassionately, but in one direction. And so often we're thinking like it's belief A. If I go to Grafton Street on Saturday, I'm going to be overwhelmed. It's going to be awful. The things we're going to do is I'm going to avoid Grafton Street at all costs. I'm going to stay at home. I'm going to check regularly to make sure my body is okay and I don't feel overwhelmed by thinking about it. But what we learn from that is that I'm vulnerable, that the world is frightening, and that if too many people are around, that it's threatening. And yet there's a whole other set of beliefs. And I suppose this is the set of beliefs that we have to try and link in with, depending on our own story and depending on what's going on for us. And that's beliefs B. That if I go to Grafton Street, I'll be really anxious, and I'll be really uncomfortable, and I'll be sweaty, and I'll be gross, because 70,000 years of evolution is going to kick in, but I'll manage. And if that's true, if that's the reality, then it's really important that I go. It's really important that I try and distract myself and actually enjoy it. And it's really important that I don't spend the whole time monitoring my heart rate, monitoring my body, monitoring my thoughts. And if I do that thing, then the thing I'll learn is actually I'm stronger than I thought I was, and the world is less frightening than I thought it was. And that's a really important thing to learn. And we can only learn it by making that walk. So, this is the one task that I'd ask you out of this 20-minute session, which is to think about the things that make us anxious. Think about the thing that I'm frightened to do. And then think about what's the alternative. What's the theory B? What's belief B? And that's often that if I do it, I'll be a sweaty, messy, anxious mess. That bit's definitely reality. But I'll get through it, and I'll manage it. And then think about what I'd need to be able to manage it. What support would I need? Who would I need to help me? I don't have to do it on my own. And then what else would be helpful? Would it help if I did it in small sections? Would it help if I had something else to help me along the way? What would be good for me in order to do it? Do I need something that's going to distract me, or something that's going to engage me, or do I need someone else to come with me? And then make a list of the easiest and the hardest things to do, and start with the easiest. And do it for a week. And see what I've learned about myself and what I've learned about the world. All right, that's 19 minutes. I'll see you again in a little while. Thanks very much.